Hello and welcome from Thessaloniki. This is our second webinar, and this is another webinar with the theme of Keratoconus. Today I'm really happy that I have with me eminent speakers from all over the world. I have Professor Renato Ambrósio from Brazil, Professor Damien Gattinel from France, and Professor Cosimo Mazzotto from Siena, Italy. And with me is also Dimitris Sakelaris, my friend and colleague from Ophthalmica Clinic in Thessaloniki. We will talk and simply pass some messages regarding diagnosis, regarding making awareness of keratoconus in the public, and also on the current improvements that we have in some aspects of treatment of keratoconus. So I will start straight with my friend Renato Ambrósio. I have prepared something in Brazilian. I'm a bit shy to tell that, but all I can tell you is that amigo do Brasil, flaminista, fanático, and enthusiast in the Kera-ring. Thank you very much, Renato, for being with us. And you can start with you.
Thank you, Miltos. Thank you very much. It's a pleasure to participate. I'm sorry I don't speak Greek. I hope you can see my slides. Is that okay? So my topic is the Violet June campaign on public awareness for keratoconus and the 2020 paradox. The Violet June campaign has two very important messages. First is that eye rubbing or scratching the eye aggravates keratoconus and may even cause ectasia. Those are two different things. And also that misinformation may make the patient and their family suffers more than the disease. So it's important that we understand we have started this campaign a couple of years ago in Brazil, and we have this campaign because of the great support from some of the companies that I have collaborated with over the last years. So I thank them very much. I have also to collaborate my friends in Brazil and in Portugal, and also the Brazilian Artificial Intelligence Study Group that is completing 10 years this year. So when we think about ectasia, it's not a new disease. We have understanding about keratoconus described in the literature since 150 years ago over that by John Nottingham. But it was when we started doing refractive surgery in the mid-80s that we saw a huge jump in the number of publications in the literature. So we broke paradigms, but we created paradoxes related to keratoconus. The role of refractive surgery is in fact paradoxical, if it's an ally or an enemy, because refractive corneal procedures can weaken the cornea and progress keratoconus or cornea ectasia. But the diagnosis has evolved, the clinical and the surgical treatment tremendously evolved. However, we have to understand what we are trying to screen for and what you're trying to do when managing patients with the disease. Understanding ectasia susceptibility, diagnosing ectasia, staging the disease, and follow-up are different aspects of the use of multimodal corneal imaging. We are overwhelmed with data, and understanding the data is challenging. That's why the revolution in evolution or artificial intelligence is related to the understanding of the diagnostic approach for keratoconus diagnosis and management. For example, when we screen for ectasia susceptibility, like in this case with 2015 distance correct vision, you can see 0.78 of a TBI, which integrates the Pentacam and Corvis with artificial intelligence using random forest index. Interestingly, this is a publication that was published in 17 in the JRS, in which we looked at the very asymmetric eyes, patients that have normal topography based on a strict objective criteria that had 90.4% of normality. And those cases will be something that we call an epitomize of ectasia susceptibility. Interestingly, ectasia susceptibility can be found in just unilaterally in one eye. For example, this patient has unilateral ectasia, and we published with many esteemed authors like my friend Damien Gattinel. This patient was follow-up after having a great result in the right eye with a Kera-ring. He moved to London, and Damien Gattinel score analyzer along with Alan Saad was done by Dan Reinstein's clinic in London, in which epithelial mapping and everything, including the TBI, was normal. So this is a unilateral ectasia, not keratoconus. Interestingly, patients like that with 2015, with fellow eye that is abnormal on the TBI, in which the fellow eye has mild keratoconus. So when we see those very asymmetric cases, the fellow eye has to be understood beyond, not over the surface of the cornea, so that we understand if the fellow eye is a true form fruste or a true unilateral case. And I come with the wisdom of Yoda that true unilateral keratoconus does not exist. However, you can have ectasia unilaterally due to a mechanical process. That's why we talk about the understanding that eye rubbing can eventually aggravate keratoconus or even cause ectasia. Those are two different things. Importantly, we have to understand treatment of a keratoconus. Treatment for keratoconus today is based on diagnosis, evaluation of the clinical and education of the patient, and surgical treatment. When we talk about treatment, patients should be understood. Education is fundamental. Allergy control, guidance so the patient don't rub the eye, and this is some video from the YouTube that is called the eye rub. A riboflavin-rich diet and other clinical treatments may be even attempt, and we do believe that the B2, along with omega-3, can help the patients do much better for preventing keratoconus progression and optimizing ocular surface. This is, in fact, one of the things that we had 100% consensus that the importance of eye rubbing is unquestionable, so that we have the duty to tell people not to rub the eye. And I'm sure Damian Gattinel will be even more emphatic on this message, that eye rubbing is a sine qua non for keratoconus. This is part, but not the only main message of the Keratoconus Violet June campaign. We have to tell people not to rub the eye, and that's the advocate of Violet, our main character in this book. And we have to tell patients also about the disease. People are really afraid about having a transplant, even though the transplant is the best transplant we have in medicine. We evolved from penetrating to lamellar keratoplasty with a deep lamellar surgery, like this beautiful procedure by Frank Price, in which you have a very deep lamellar dissection. And also we can use the femtosecond laser for this approach and having a better result in terms of wound adhesion. Surgery for keratoconus is to halt ectasia progression and for visual rehabilitation. It's not a refractive procedure. Refractive procedure and therapeutic procedures should be understood as different procedures. Even though, like a lion and a cat, they share a lot of similarities, they are not the same. Very importantly, we have cross-linking. Corneal cross-linking was first described in the mid-90s by Professor Seiler in his group, and eventually it broke a paradigm, it changed the way we treat keratoconus, because now we have the ability to help disease. However, when to do it is important. So you need to have diagnostics to understand the follow-up and eventually do the surgery with less harm. As Milton just described, I am very enthusiastic about the Brazilian ring, the Kero ring, and the Ferrara ring. We have the Brazilian history very nicely described by my friend Alexandre Paratella in this channel in the internet. We have many techniques for intercorneal ring implantations, and that's the only technique that I think it's exclusively should be done with the femtosecond laser. And having experience with over 10 years with the femtosecond laser, that's the most important indication for this procedure. The corneal ring has improved, and we have asymmetric rings. And why we have asymmetric rings in the thickness that is progressive? Because we have an asymmetric disease, like in this case. Importantly, the paradox of keratoconus is that it's a new subspecialty in ophthalmology. We have broken paradigms. We have paradoxes because when you should do surgery, you should do as soon as possible. But if you don't need the surgery, eventually should not have it. When, why, and how to treat patients with surgery. Every patient should be individualized, and so that we understand the patient's needs. Excuse me. The role of artificial intelligence is very unquestionable. However, when you think about individualized medicine, the paradox is that with patient education, we still must to do the humanized medicine with a medical mission to heal few times, relieve often, and comfort always. I'm very happy to be here and looking forward to the discussion about Keratoconus management in the Valley of Junho. Thank you very much for your kind attention.
Thank you very much, Renato. And I think it is a great job that you're doing in Brazil. Of course, you had a fantastic experience in the US for many years, and what you're doing both in Brazil and in ISRS for the diagnosis of keratoconus, but for the awareness as well of keratoconus is very important. And I would like to share that we have translated the booklet, the Violent June in Greek, and hopefully we will do another campaign, a more stronger one, the following year to support, to make open, public, and aware. And I will try personally to get the press involved on that. It's very important. Awareness is the key for the keratoconus. The earlier we can treat them, the better. And of course, you're a virtuoso of Kera rings, and one of the future meetings we will talk about that as well. Thank you very much, Dimitri. You want to